Jonathan Suggo. The beginnings of the community now known as Newport Richey originated as a tropical vacation spot with beautiful weather and excellent fishing at the mouth of the Plashatascotee River. After settlement, the community grew steadily and owed its commerce to the many orange groves and cattle ranches that were exported to such areas as far as Cuba. With the coming of the 1920s, Newport Richey became the vacation spot of many wealthy and famous actors, which led to the opening of new theaters and the hacienda in 1927. The city began to boom, and with money being invested, many were beginning to herald it as the soon-to-be Hollywood of the East. However, the downturn during the Great Depression placed a damper on the economy, and the city's dreams never came to fruition. Since the community has continued to expand and grow into the city that it is today. The structure of the community appears to be on par with that of other communities within the Pasco County area. The governing body is the City Council, which is its legislative body, that consists of the mayor, deputy mayor, and 3 council members. Much like other communities, it provides the infrastructure of the local government and has the ear of the community. By adopting ordinances, establishing municipal policies, making appropriations, levying taxes, and reviewing, revising, and adopting the budget, the council not only runs the day-to-day, but institutes important governing principles and decides how funds are spent. As with any governing body, the main issues and complaints of the community members are that the process works too slow and it seems like real change is hard to come by. In this way, community members feel as though the structure is stagnant, with little adaptability built into the system. The population of Newport Richey has surprisingly taken a slight dip of 1,292, or 7.97% in the last 10 years, which is in stark contrast to the population increase of 25.3% in Pasco County as a whole. This could be a result of the large difference in population density of Newport Richey, as opposed to Pasco County as a whole, which could be the impetus for the general dispersion of the population, in addition to the declining prices of homes, making it less dense areas of Pasco more affordable. When compared to populations of both county and state, Newport Richey has both a smaller percentage of individuals under 18, 17.9%, and a larger percentage of individuals over 65, 23.9%. This could pose serious problems in the coming years with a quickly aging population, inevitably requiring aid and a smaller crop of youth available to provide it. Much of this stems from the earliest segments of the baby boom generation, resulting in a worldwide population aging. By 2030, it is estimated that older adults over the age of 65 will constitute 20% of the U.S. population. This is an aging population that the United States is unprepared to handle, with its accompanying social and economic impacts. Based on the community assessment, Newport Richey has an abundance of health-related resources, starting with 2 major 200-plus bed hospital facilities in Morton Plant North Bay Hospital and Medical Trinity Center. These facilities are top-rated facilities with Joint Commission accreditation in a number of fields, from heart attack to pneumonia, surgical care, stroke, heart failure, and even inpatient rehabilitation programs. Additionally, there are various walk-in clinics and physician offices in the area. To address the elderly population is a large number of assisted living facilities, as well as assisted living communities, with multiple apartments and a virtual community where aid can be provided at any time for those who require it. For those that have financial issues in regards to receiving care, the community as a whole has outreach programs to provide to those who cannot provide for themselves. Good Samaritan Health Clinic, United Way, and Pasco County Human Services are just a few programs that provide free-of-charge medical and dental services, as well as temporary family assistance, food, clothing, and emergency shelter. These are specific community objectives that I've taken from Healthy People 2020 that I feel suit the community as a whole. Older adults. Increase the proportion of older adults who are up to date on a core set of clinical preventative services. The rationale for this objective is the increasing age of the current population and the importance of primary prevention in overall health and a decrease in healthcare costs. Social determinants of health. Proportion of persons living in poverty. The rationale for this objective is Newport Richey's 15.7% population under the poverty line, which is much greater than the national average of 14.3. Social determinants of health are conditions in the environment and community that affect quality of life, outcome, and risks. Substance abuse. Increase the proportion of adolescents never using substances. The rationale for the objective is the ever-present substance abuse that is seen nationwide, and it is no different in Newport Richey. On a day-to-day basis, the majority of the patients I care for in the hospital are either struggling with substance abuse or have a previous history of substance abuse. Environmentally, Newport Richey meets all and in some cases exceeds environmental standards. In regards to water quality, the 2014 Annual Drinking Water Quality Report reported that the City of Newport Richey met all federal and state requirements and all contaminants were within maximum contaminant level. Treatments included aeration for hydrogen sulfide removal, chlorination for disinfection, and fluoridation for the dental health. In regards to the Air Quality Index, Newport Richey scored a 60.3, in comparison to the average in the U.S., which is 74.2. This number indicated the community falling into the moderate air quality conditions category. Another important area of environment is addressing by the community is the mosquito control, due to the nuisance and possibilities of disease transmittance. Being as all of Newport Richey is located on or near water, this makes it an extremely difficult task. However, the county seems to do a good job as no new outbreaks of West Nile or Zika virus have been recorded in the area. The community has also done a very good job of trying to preserve the environment by maintaining many parks and preserves, as well as the numerous mangroves and waterways leading towards the Gulf. Some of the issues from the community members fall into the same category lines as surrounding communities, mainly having to do with the litter and the further urbanization of the community. Recently, there has been more and more housing developments placed, which could be some members complaining of overdevelopment. Based on the city council meeting that I observed, it was not that well attended, and there were only a handful of individuals at the meeting. However, it seemed as though the officials were very receptive to the citizens, and during Vox Pop, an opportunity for citizens in the audience to address the city council, the council members took citizens' requests into consideration and even made amendments to legislation to be voted on. The community budget seems to provide for all the necessary aspects, and its spending prioritizes economic growth, infrastructure upkeep, and spending for government institutions such as schools, police force, and fire department. Areas of concern focus on economic issues, as the percentage of individuals under the poverty line is 15.7%, which is greater than the national average and much larger than the county average of 9.9%. As a result, crime and substance abuse are also at a higher rate, causing concern for the citizens. During the council meeting, one of the citizens brought forth complaints on drug deals going on in his community, and how after frequent calls to the police force, little was done. In response, the police force claimed it did not have support from any governmental legislation in such matters, and were left to fend for themselves. New legislation or revisions might perhaps be an area to examine in order to make steps towards improvement. On this slide, we take a look at some of the community needs and problems that I find were important, starting with the most important: economic community status. As previously mentioned, the percentage of individuals under the poverty line exceeds that of the average. In response, many other negative effects result from an impoverished population. Without adequate funds, individuals can't provide the basic needs for health and wellness, such as food, shelter, clothes, and health care. Substance abuse. Substance abuse poses a serious problem in the community, and exhibited by the number of patients admitted to the hospital due to said abuse. Substance abuse leads to a number of health concerns from cirrhosis all the way to septic emboli. Care for the aging population. As earlier discussed, the nation as a whole is aging, and Newport Richey even more so. With the added elderly population comes more economic and social strains on the community as a whole. Public schools. The public school systems are where we can have some of the most impact. Based on Great Schools Rating 2016, Newport Richey has an overall grade of 5 on a scale of 0 to 10. This ranks the city right in the middle of average, and that is something we can improve on. By improving the schools, we improve our future. Homeless community. As a result of high poverty percentages and substance abuse rates, the homeless community is growing. This community puts strain on the society in the form of financial dependency and increased crime rates. Through outreach programs, we can work towards decreasing this population. Domestic and child abuse. One of the most underreported crimes, which has a cyclic trajectory. Domestic and child abuse creates physical and emotional scars that are far-reaching and affect the community. Many times, it is nurses who are the first to identify and bring these situations to light. The reasoning for the order of placement is that when first and foremost the economic status of the community improves, the rest will follow suit to some degree. Substance abuse is important because it is so prevalent and a very frequent case of health issues and directly related to the homeless community. Third, The aging population is a new issue that I feel has not had much consideration placed upon it, and it should place an even larger strain on the already troublesome healthcare system. In any society, public schools need to be an area of constant improvement because the direction of public schools translates to the direction of the future of the community. Next, the homeless community, due to the varied implications on health and crime. And lastly, domestic and child abuse, as I felt the others were more important and based on a smaller scale of the issue. Right now, the major global issue that is affecting millions is the massive amounts of Syrian refugees flooding into neighboring countries and Europe. This mass influx of immigrants that are essentially nomads have traveled long distances with little to nothing on them, often in poor health. As a result, the UN and European countries have to find ways of providing housing, food, clothing, and medical care for these individuals. The UN High Commission for Refugees has been supplying much of the funds by covering 75% of the cost of life-saving, obstetric, and emergency hospital care for refugees. This number has approximated to $727 a person, with the individuals having to find way through non-governmental organizations or charities to assist in paying the remaining fees. This is similar in a sense to the community dealing with the non-insured and homeless community, much the same way in which the United High Commission for Refugees pays a large majority of the cost. Medicaid takes on the majority of the cost for these individuals. For those individuals that fall through the cracks, there are a number of community resources such as the Good Samaritan Health Clinic, United Way, and Pasco County Human Services mentioned in the health-related resources section. A community health nurse can help intervene by directing individuals towards these services, in addition to offering education in primary prevention and health and wellness lifestyle changes. In this way, those needing care can be identified earlier and better. More affordable care can be delivered sooner.